Dr. Qureshi. I'm a weight loss surgeon here in the Dallas-Fort Worth area. I've been doing weight loss surgery for almost 20 years, have a lot of experience with it, and just wanted to take a few minutes to talk to you about Ozempic and the other medicines like Ozempic, which we call GLP-1 medications for weight loss. I know a lot of y'all are taking these medications or have been taking them, and I just wanted to kind of go over some things about these medicines that you should consider if you're taking them or considering taking them. So medicines like Ozempic, Wegovy, Mounjaro, or Zepbound were actually designed for diabetics to lower their blood sugar. And it was found that when they were taking these medications, they actually started to lose weight. And so that's why those medicines have become very popular for weight loss. But the thing to consider with these medications is the kind of weight loss that you get with them is really only about 10 to 30 pounds. So despite what you see online, the average weight loss with Ozempic or these other medications is 10 to 30 pounds over a 6-month period. Now, keep in mind also that if you stop the medication, you'll gain the weight back, okay? And if you keep taking the medication, eventually your body gets used to it, and so it won't be effective anymore. And so I think that, it's something to take if you're wanting a short period of time to lose weight or a small amount of weight loss. But if you're looking for something where you want to lose 50, 100, 150 pounds, really weight loss surgery is going to give you that long-term solution. These medications really won't do that for you, unfortunately. The other thing to consider too is the side effects. So a lot of my patients who are taking this medication tell me that they have nausea, vomiting, diarrhea, constipation. A lot of you probably have experienced that too. Now, some of those side effects improve after the first couple of weeks being on the medication, but there's also some long-term side effects like bleeding from the stomach or vision problems, liver problems, long-term fatigue. There's even a side effect where your stomach doesn't empty properly, which can be permanent even if you stop taking the medication. And so you definitely want to think about that when you start taking these or you're on these medications, because you may have side effects that could be temporary, but they could be long-term, and you're having those side effects for something that's only going to give you really a small amount of weight loss. Finally, the other thing to consider too is the cost. These medications cost a lot. They're very expensive. Now, some insurances cover these medications, but they really only cover them for diabetics. But even with insurance coverage, most of these medicines are anywhere from $400 to $1,200 a month. So very expensive. You can imagine if you're taking them for 3 months or 6 months or 9 months, it adds up and adds up pretty quickly. And so I think that these medications do have a role for someone who wants to lose a small amount of weight, but someone who wants to lose it permanently and lose 100 or more pounds, I really think weight loss surgery is the best long-term solution.